I'm Jules Payne. I'm the Chief Executive of Heart UK, the cholesterol charity. We're all about preventing early heart disease caused by high cholesterol and cardiovascular disease, and we provide support, guidance and education to patients as well as healthcare professionals treating those patients. We were absolutely delighted when the NHS Health Check was introduced in 2009. We have been campaigning for years for a prevention programme for CVD. In fact, it's the only programme and it's really, really important, and we are hugely supportive of anyone who receives an invitation to the NHS Health Check that they take that up. Because after all, cholesterol is a silent killer and you don't know that you have a problem until you know you have a problem. And as part of the NHS Health Check, it's important, clearly, you do a number of checks, of which cholesterol is one. And it's also really important for you to inform the patient around their numbers, their specific numbers. So the total cholesterol, the HDL and the LDL. And certainly we can help you provide support with the patients. So you have a certain amount of time that you can spend with the patients, but we can complement you with that to provide patients with further information. But we would like them to know their numbers. In fact, our mission is for the majority of UK adults to know and understand their cholesterol levels and be taking necessary action. So knowing it, clearly you need to have a test in order to know that. That could be a point of care test or bloods you send off to the lab. Understanding it, that's slightly different, and that's where we can support you because you won't necessarily have all the time to explain that to the patients. Taking necessary action, that's where we can also help you. You'll have some information and certainly you can hand out Heart UK information. We have a website that's very rich with information, and it has a specific area for healthcare professionals and lots of information for patients. So please signpost Heart UK to your patients and come to us yourself for support and guidance, and of course education. We are at www.heartuk.org.uk.
Gather all the equipment you require to perform the test. You will need a pair of gloves, an alcohol wipe, some cotton gauze, a pipette, a lancet, and ensure this is set to the deepest setting by twisting the head toward the deepest line, and finally a test strip. Before the testing begins, explain the procedure clearly to the client and ensure you have obtained their consent. It's important to check the client's hands are clean, warm and relaxed. If they are too cold, it might be difficult to get an adequate sample of blood. To warm the hands, ask the client to wash under warm water or rub them together. Ask the client which finger they would prefer the sample to be taken from. Ideally, this should be the middle finger of their non-dominant hand. Clean it with an alcohol wipe to remove any possible fats, grease or soap residue. Then dry the finger thoroughly with cotton gauze, as alcohol could affect the outcome of the test. Switch the machine on and insert the test strip. When lanceting the finger, a single-use retractable lancet is recommended to produce the required sample of blood. A standard diabetes lancet is not recommended for this test. Ask the patient to place their hand on the table, holding the finger from the base. Then push the lancet firmly on the finger to puncture the skin. Ideally, this should be at the side of the fingertip, about 5 mm from the edge of the nail bed, as there are less nerve endings here and will be less painful for the client. Dispose of the used lancet in a suitable sharps bin. Always remember to wipe away the first drop of blood, as this may contain tissue fluid. Apply pressure along the finger, but don't press or squeeze anywhere near the puncture site, as this may affect the sample. Without squeezing the pipette, simply touch the tip to the drop of blood and it will automatically fill up to the black line. Wipe off any excess blood and provide the client with some gauze. Ask them to apply pressure to the wound until the bleeding stops. Apply the blood sample to the test strip and then dispose of the pipette in a suitable sharps container. The analyzer will start testing and the results will be displayed within 2 minutes. Navigate through the results, ensuring you've recorded all the required measurements. Remember to dispose of the used test strip in the sharps bin. Finally, share the results with the client and record them in their notes.
Hi, I'm Linda Main, Dietetic Advisor at Heart UK, the cholesterol charity. When you do an NHS health check, it's important to have a measure of both the quality and the quantity of the cholesterol in the patient's blood. There are 3 main figures that you need to know, and your patient needs to know these too. First of all, the total cholesterol. This is a measure of the total amount of cholesterol in the patient's blood. Secondly, the HDL cholesterol. Now, this is a measure of the good cholesterol, the type of cholesterol that goes around the arteries and picks up any excess cholesterol from the cell wall and takes it back to the liver where it can be disposed of. The total cholesterol to HDL ratio is just that. It is the total cholesterol figure divided by the HDL figure. And it's this ratio that doctors and nurses will use when they calculate the overall patient's cardiovascular risk. There's also something called the LDL cholesterol, and this is a measure of the patient's bad cholesterol. So if there is too much LDL cholesterol in the bloodstream, this can contribute to furring up the artery wall, which over time can lead to blockages that cause heart attacks or angina or strokes and other forms of cardiovascular disease. Now, there are 2 main scenarios that you might be faced with. Firstly, the patient may have a high total cholesterol level. And generally this is a total cholesterol over the level of 5 millimoles per litre. There's lots the patient can do to try and bring this cholesterol level down, and diet is really a key area for them to concentrate on. It is about reducing the amount of saturated fat in the diet, and saturated fat is found in things like fatty meats and meat products, butter, lard, and anything made from these, such as pies and puddings and pastries, cakes and biscuits. It's important to have more unsaturated fat in the diet, and this can be found in things like nuts and seeds, avocado, oily fish, and also healthy cooking oils such as rapeseed, olive oil and sunflower oil, and spreads made from these. It's also important to have more whole grain foods in the diet, such as oats, and also more fruit and vegetables, low-fat dairy foods, and also to have more meat-free meals as well. The other scenario you might be faced with is where the patient has a low HDL cholesterol. If their HDL is below 1 millimole per litre in a man or below 1.2 millimoles per litre in a woman, then it's important to advise them that there are things they can do to increase their HDL cholesterol, their good cholesterol. There are 4 main things. First of all, it's about adopting the diet that we've already spoken about, reducing saturated fat and increasing the amount of healthy unsaturated fats in the diet. Many people with low HDL levels often have accumulated quite a lot of fat around their waistline. They're often apple-shaped. And it's important for them to try and lose some of this fat. And they can do that firstly by being more physically active, and secondly by reducing some of this weight, going on a restricted diet to help with some weight loss. And the fourth thing that they can do is to stop smoking. Many people with low HDL levels are smokers, and smoking does reduce your healthy HDL level. So if they are smokers, it's important for you to talk to them about how they can stop smoking. If you need more advice on diet and lifestyle, please do visit our website at www.heartuk.org.uk or call our cholesterol helpline on 0345 450 5988. Thank you.